Welcome to today's presentation on reducing stress for parents. We have launched our Liaison Leadership Series. Today with us presenting is Wright from Hedgepeth. She is a parent liaison. And Stephany Diaz, who is also a parent liaison from Parker Elementary School. Welcome, ladies. We enjoy to hear your presentation.
Thank you for having us. We will be presenting today on reducing stress for parents. We have prepared a short presentation for you. What is parental anxiety? Parental anxiety usually involves excessive worrying about the potential for things to go wrong. Anxious parents may verbalize their worries to their children, who may then take on these fears and concerns as their own. Identify your sources of stress. What events or situations trigger stressful feelings? Are they related to your children, family, health, financial decisions, work, relationships, or something else? Sometimes we find ourselves stressing about things that we have no control of, and this is why the anxiety comes over us and kind of takes us and just binds us up. We will watch a short video, Reducing Stress Through Deep Breathing by Johns Hopkins Medicine.
The first exercise in our relaxation toolkit involves something we've all experienced at some point or have been very close to experiencing: shortness of breath during times of stress. When we're anxious or stressed, our breathing becomes very shallow. The breath we take isn't fully drawn into the lungs, and there's more contained in our chest. This brings us to our very first exercise of stress reduction: deep breathing. It's also known as abdominal breathing, belly breathing, or diaphragmatic breathing. This technique consists of breathing through the belly and not the chest in a slower and deeper fashion. There are many physical benefits to this simple technique. Deep breathing lowers your heart rate, your blood pressure, increases your energy levels, and decreases your muscle tension and pain. Not to mention the mental health benefits, including decreased anxiety and stress, as well as improved sleep and a more focused mind. Let's practice. Sit or lie down in a comfortable position. Begin by taking a deep breath in and a long, relaxing breath out. The idea here is to achieve a slow and steady breath. Go ahead and place one hand on your chest and your other on your abdomen, if this feels comfortable for you. Now try and keep your chest rather still and have your abdomen expand and contract as you deeply breathe. Some people find it helpful to count while they take their deep breaths. For example, you may count like this: in, 2, 3, 4. Out, 2, 3, 4. In, 2, 3, 4. Out, 2, 3, 4. This counting can help you with consistency. Try to practice this regularly a few times throughout the day for a few minutes. It will relax you physically and mentally during times of stress.
Thank you. So now we will review and discuss tips to help reduce stress for parents. We will learn our own stress signals, identify your source of stress, recognize how to deal with stress, find healthy ways to manage stress, and then finally take care of yourself. So you want to be able to gauge your stress signals Find out your identifiers and realizing what actually makes you stress.
How you deal with stress. Determine if you are using unhealthy behaviors such as smoking, drinking, alcohol, or under eating to cope. Is this a routine behavior or is it specific to certain events or situations? Do you make unhealthy choices as a result of feeling rushed and overwhelmed? Healthy ways to deal with stress. Try not to bring stress home. Seek opportunities for fun. Remember to relax and recharge. Ask for backup when you need it. Connect with fellow parents. Take a break from it all. Keep your life well balanced. Everyone experiences stress differently. How do you know when you are stressed? How are your thoughts or behaviors different from times when you do not feel stressed? Do you have more bills than money? Children not behaving in school or at home? Do you feel better when the bills are paid? Are you able to enjoy spending time with your children?
Find healthy ways to manage stress. Consider healthy, stress-reducing activities such as meditation, exercising or talking things out with friends or family. Keep in mind that unhealthy behaviors develop over time and can be difficult to change. Don't take on too much at once. Focus on changing only one behavior at a time. Take care of yourself. Eat right, get enough sleep, drink plenty of water, and engage in regular physical activities. Ensure you have healthy mind and body through exercises like yoga, taking a short walk, going to the gym, or playing sports that will enhance both your physical and mental health. Take regular vacations or breaks from work. No matter how hectic life gets, be available for yourself. Even if it's just simple things like reading a good book or listening to your favorite music, find something you like and make a hobby of it. Relax your muscles. When you are stressed out, your muscles get tense. Do some deep breathing to help keep yourself calm. Enjoy a nice hot shower or bath. Get a good night's rest. You want to talk about your problems? Look for trusted friends or family members and/or a therapist. Talking about things that bother you and problems you are facing can help lower stress. So here's just some fun pictures just to kind of, my baby here saying, did you smile today? That's so important. Smiling, it doesn't cost you anything. And it actually uplifts you. So you wake up in the morning, you start your day off and you're smiling. It gives you a good avenue that today will be a good day for yourself. Swimming definitely actually is a good stress reducer. Yoga, drinking plenty of water, and spending time with your family, my first family there in the corner. Here's another video. Parents need stress management also.
My name is Dr. Lauren Hack, and I'm a clinical psychologist and assistant clinical professor in the UCSF Department of Psychiatry Child and Adolescent Service Division. Today, I'm going to share some tips for using helpful thinking and self-care activities to manage parenting stress. Decades of research tells us that our thoughts impact how we feel, what we do, and how we do it. Given this, it's no wonder that one's thoughts about their ability to parent, as well as thoughts about why children behave the way they do, influence how one actually parents and how children respond. Fortunately, research also tells us that as parents, engaging in self-care activities and helpful thinking may result in feeling calmer and more confident. This in turn may lead to more effective parenting and child behavior. One way to improve helpful thinking as a parent is redirecting attention to what you can versus can't control. Unfortunately, there's a lot we're not in control of right now, such as when children will be able to go back to school, when adults may be able to go back to work, and when we'll be able to visit our friends and family members again. It's natural to worry about these uncontrollable aspects of our lives, and getting stuck on these worry thoughts is going to result in feeling overwhelmed, hopeless, and stressed. When you notice these thoughts, redirect yourself to something you can control right now, such as establishing a basic routine for your child or helping them reach out to friends or family members on the phone or virtually. Another aspect of helpful thinking for parents that may be particularly important right now is adjusting expectations and limiting should thoughts. We may be tempted to judge ourselves and our children for not meeting the same expectations we normally would, such as how much work can get done each day. One of my favorite mentors once advised me to not should all over myself. And I tell myself this adage not only to bring some humor and lighten my mood, but also to remind myself that expectations often need to be adjusted, and the current situation is the perfect example of this. If you find yourself making unhelpful judgments about why things aren't getting done or why your child's behavior is spiking, try to refocus on an explanation that we're all going through an unexpected transition right now, and it's unrealistic to expect that productivity and behavior from anyone is going to be exactly the same. Relatedly, as you're letting go of or adjusting some expectations, it's important to acknowledge little victories. Perhaps your child didn't finish their homework packet today and you didn't get much work done, but maybe you all worked together to prepare dinner and ate together. That's really a win. Your child can be learning valuable lessons about everyday life skills or through hands-on activities, even if it's not the same mode of learning that you're used to. It's important, particularly in trying times, to focus on self-compassion and validation. This is helpful for our own stress management, and it also provides nice modeling for our children. Some days you're going to feel more effective than others, and it's natural to have ups and downs. Remember that none of us signed up for this, and really we're all doing the best we can. In addition to using these helpful thinking tips, you can prevent and manage parenting stress by scheduling in quick, easy, and realistic self-care activities. Although it may seem like there's no time to prioritize self-care right now, no one can pour from an empty glass. Take a moment each day to complete an activity you enjoy, or even make a slight adjustment to an activity you're already doing so it's a bit more pleasant. That can help fill up your glass, help you be more patient, and be a more effective parent. For example, maybe you can listen to your favorite album or podcast while getting breakfast together. You could work some stretches or deep breathing in tiny moments between other tasks. Even a 90-second break to focus on something like a guided meditation, such as observing the Monterey Bay Aquarium live feed freely available online, can be calming. It could be as simple as adding some flavored creamer to your morning coffee. We're more likely to complete goals if we write them down, so I encourage you to take a moment and schedule in one simple self-care activity right after this video. We're even more likely to complete goals if we discuss them with someone else. We'll also encourage you to share your self-care goal with a friend or family member. Thank you for listening, and I hope you found value in these tips for scheduling in self-care activities and using helpful thinking for parent stress management.
Thank you. Okay, so some resources that are available in the Mercer County area, and this is for mental health education. It is Mercer Street Friends, New Beginnings Community Center, and NAMI of Mercer County. Counseling sites that you may be able to schedule independent counseling. It is with Henry J. Austin Health Center, Oaks Integrated Care, New Horizon Treatment Services, and Another Door Opens. These are the sources that was used to prepare this presentation today. WebMD, Johns Hopkins Medicine, Strategic Psychology, Health, ClevelandClinics.org, ParentingEd.org, and also NowPal. This does conclude our presentation for today. As far as our slides, I do have a guest speaker, which is Hedgepeth Williams' very own school nurse, Miss Lori Nixon, and she will just talk to us about stress and how it affects our lives.
I don't know how I'm going to beat this great presentation. You guys really did a great job covering it. So how about I start and let's go over the physical and emotional symptoms of someone that's under stress. So we can start how stress affects the body. First of all, we have emotional symptoms. A person can be easily agitated, frustrated, moody, feeling a little overwhelmed, like you're about to lose control, or you need to take control. So these are sometimes, you'll see this with our parents, you know, they're coming in, they get students coming in with another behavioral problem, and they're just completely overwhelmed, and they just start off being very defensive. And right now, you know, okay, they're completely stressed out. They have difficulty relaxing, quieting, feeling bad, they have low self-esteem, loneliness, worthiness, depressed, and avoiding others. So those are some emotional symptoms that we would find generally on someone that's having problems dealing with stress. All right, here are some physical symptoms. And people forget that physical symptoms are very real, and they can feel very, very ill just being stressed out. When I was in college, my third year in college, I was convinced I had diabetes. I had all the symptoms, dry mouth and all this stuff. And I'm in nursing school, and I couldn't figure out what was wrong with me. I thought, oh my God, there's something seriously wrong. Went to the doctors, and the doctor says, you're just stressed. You're showing the symptoms of being stressed, because it's finals, I'm in clinicals. So it was eye-opening for me, like, oh my goodness, you can show stress with physical symptoms. So here are some of them. We have low energy, headache, upset stomach. That can include diarrhea, constipation. Sometimes I see this in my students with a big test or something really bothering them. All of a sudden they're in my bathroom. So kind of do assessment, say, hey, what's going on here? Aches, pains, tense muscles, chest pain. Some people, almost like an anxiety attack, they can get chest pains, rapid heartbeat, difficulty sleeping. They get run down, they can have colds, they can get upper respiratory infections, they can get viral infections, a loss of sexual desirability, nervousness, shaking, ringing in the ear, cold, sweaty hands and feet. Sometimes they can have a twitch in their eye, a twitch in their mouth, dry mouth, difficulty swallowing, clenched teeth, grinding teeth. These are all physical symptoms that the stress is unable to be controlled, and they're actually exacerbating in physical symptoms. And then you have your cognitive symptoms. They're constantly worrying, they have racing thoughts, they're forgetful, they're disorganized, the inability to focus, poor judgment, being pessimistic, or only seeing the negative side. We have our behavioral symptoms, changes in appetite, neither not eating or eating too much, procrastinating, avoiding responsibilities, an increased use of alcohol, drugs, cigarettes, exhibiting nervous behaviors such as nail biting, fidgeting, pacing. So these are the symptoms that usually exacerbate when the stress level is getting beyond what the person can handle. So then, what are the consequences of this long-term stress? So every now and then, stress is good. It helps us move. It's part of life. But with it ongoing, chronic, it can exacerbate through many serious health problems. And these are some of them that include mental health problems, such as depression, anxiety, personality disorders. We find a lot of these symptoms in our students and parents who have exhibited post-traumatic stress syndrome, with traumatic life events. So these are ongoing, especially when we see a child who exhibited something horrific in early childhood, and then they're starting to show some kind of mental disease. We have cardiovascular disease, including heart disease, high blood pressure, and high blood pressure is already a risk with our community. So stress kind of exacerbates it. So it's very important that we teach our families how to control our stress. Abnormal heart rhythms, heart attacks, stroke. Obesity and other eating disorders. When we're stressed, many people go to stress eating, especially now during COVID. We have a lot of people just being stuck at home, and they're just eating all the junk food they can find. And the Academy of Pediatrics actually did a study, and they're seeing that there is almost a 20% increase in obesity in our children right now because they're stuck home with this COVID thing. So that's something else that we need to look into. Women have menstrual problems, there's sexual dysfunction, impotence, and premature problems with men. As adults, you can have skin, hair problems such as acne, psoriasis, eczema, permanent hair loss. That's another issue that I've seen. You can have gastrointestinal problems such as colitis, irritable bowel syndrome, diverticulitis. So long-term stress can trigger all these. Okay, and as Star mentioned, help is available for stress. Stress is part of life. What matters most is how you handle it. The best thing you can do is prevent stress, overload, and the health consequences that come with it. So as Star mentioned before, you're feeling overwhelmed, you need to talk to your doctor, recognize the symptoms of stress, because it can be signs of other health problems. Your doctor can evaluate your symptoms and rule out other conditions. And if stress is to blame, your doctor can recommend therapists or counselor to help you feel better to handle your stress. As a nurse, and my big pet peeve is prevention, prevention, prevention. So I would like to, as much as we all have stress as part of our lives, we need to learn how to minimize it the best we can. Some life events make it unavoidable to avoid any type of stress, but at the same time, we need to learn how to cope with it. Star did some great resources. Here are two additional ones, the Greater Trenton Behavioral Health Care and the Princeton House Behavioral Health. Both of them offer outpatient and inpatient services. We have that. Those are the two behavioral places that our youth can go to when they're feeling overwhelmed and need therapy. All right. So this is we'll get a little bit into this. Learn to be proactive, not reactive. Due to our environment, some of our families, parents tend to react negatively than not. And like I said earlier, we see a lot of times our parents are just angry. They're already anticipating the bad news. And we want to go ahead and teach them how to cope with the life situations they've been dealt with so they can be able to be a more positive. And I know it's hard, but we need to see if we can help them. They're exposed to trauma. They're never taught how coping skills to begin with. Coping skills has to be taught. It's not something that you automatically learn. You learn the coping skills from other family members, from your parents, from teachers, other members of the community. So we need to learn to teach everyone how to cope. And if they don't get resolved, then the issues that are causing stress will exacerbate into the physical symptoms. So Star just had some great ideas. I just had some other things for types of coping skills. We have self-soothing skills, things that help soothe you. Take 5 minutes to hear your favorite song, get a hug, something, not that I encourage eating habits, but just a little taste of a piece of chocolate or something that you like might help bring down your stress. Aroma candles, distraction, hobbies, things to get your mind off of things for a while. Watching a good movie, playing board games with the kids, that type of stuff. Emotional awareness, be able to identify when you are being stressed and how to take care of it. You have mindfulness here, meditation, relaxation, and always make sure there's a crisis plan. Like, you know what to do, how to get help.